The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe Show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe Show.
Today I want to talk about musculoskeletal stuff. We're going to start out with peripheral neuropathies, very common, and these can be caused by osteoporosis and degenerative disc disease. So we're going to start out by talking about osteoporosis of the skull and degenerative disc disease. Osteoporosis of the skull can create as many as 12 different diseases. There's 12 pairs of cranial nerves come out from the brain through the skull through a little tunnel to the outside and do things. Okay? The first cranial nerve is the one where you have smell, the sense of smell. Okay, your nose and taste and that kind of stuff. Okay, and so we're looking at the first cranial nerve that gets squeezed. You lose that sense of smell, the sense of taste. You can also be deficient as those nerves are being squeezed by the osteoporosis of the skull. You can also be deficient in certain minerals. Okay, or both. And then, of course, you get the second cranial nerve, which is the optic nerve, getting squeezed. Oh, you gradually lose your vision. And then, of course, you have, let's go to the fifth cranial nerve, very common, trigeminal neuralgia, pain in the face. The fifth cranial nerve is being squeezed as it comes through the skull, which is osteoporosis. The tunnel that fifth cranial nerve is coming through is filling up with connective tissue. And then, of course, there's the seventh cranial nerve, the facial nerve, being squeezed. Oh, and you get Bell's palsy. One side of your face droops, because it rarely happens in equal amounts on both sides of the skull. And you look like you had a stroke. And then, of course, the eighth cranial nerve is kind of interesting. It has two major branches. The auditory branch, one part of it, if you're squeezing the auditory branch of the eighth cranial nerve because you have osteoporosis of the skull, you're going to get a gradual hearing loss, not a sudden hearing loss like you get from a stroke. And also, you can get tinnitus, ringing in the ears, a chirping or a tone, kind of like that, okay? And then, of course, you have the eighth cranial nerve's vestibular branch being squeezed. You can get ataxia. You get kind of like motion sickness and get a little bit of even nausea going along with it. And then the ninth cranial nerve being squeezed, which is glossopharyngeal nerves, your voice changes. This happens a lot in seniors. They'll lose their voice because the glossopharyngeal nerve, number 9, actually controls the vocal cords. And the 10th cranial nerve, the vagus cranial nerve, has a branch called the recurrent nerve. When it gets squeezed as it comes out of the skull, you get the hiccups because the recurrent nerve controls your diaphragm. And so the doctors like to do surgery and cut that recurrent nerve when you get hiccups that won't go away. But really, it's just osteoporosis of the skull. And on and on and on and on. Okay? Then you get degenerative disc disease. You can get peripheral neuropathies, numbness and tingling in your fingers and so forth when it happens in your neck. You get degenerative disease, disc disease in between the first four vertebrae in your upper back, T1, 2, 3, and 4, thoracic vertebrae T1, 2, 3, and 4. Those discs, as they shrink, degenerative disc disease, they squeeze the vertebrae, get closer together, and squeeze the roots of the spinal nerves that control the rate and rhythm of the heart, and you get what's called atrial fibrillation. Doctors will run up $500,000 worth of cardiac procedures. They'll install pacemakers, defibrillators, ablation, retroversions. They'll do a heart transplant, run up $500,000. Won't solve the problem because it's a back problem. And then you have incontinence. You're dribbling urine. You have urgency. You wake up 10 times in the middle of the night. It may be worse at night when you lay down. And it's degenerative disc disease between the lumbar vertebrae, which these nerves control the bladder. And, of course, when you have the vagus nerves in the lumbar area being squeezed, you get what's called sciatica, numbness and burning and itching and pain in the feet. You can put all the topical pain relievers you want in your feet. You're not going to get much results because it's all due to this degenerative disc disease in the back. Okay? And then you have osteoporosis of the long bones and things like that. And doctors say, oh, you have bone loss. You know, your bone density test says you have bone loss. Take some extra calcium. Well, that won't work much because your bones aren't just made of calcium. You need all 90 essential nutrients. So we have what we call the ultimate bone and joint pack, bone and joint pack, okay, 1 per 100 pounds of body weight. And then, of course, you can throw in the MSM, 3 of those twice a day per 100 pounds, vitamin D3, 3 of those twice a day per 100 pounds. And guess what? Your body will take those raw materials and rebuild the disc, rebuild the bones. And over a time period is anywhere from 30 to 90 days, all these symptoms go away. You don't need surgery for the most part, okay? Get a hold of the book, CD, DVD, Dead Doctors Don't Lie. Get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. And, of course, there's a great CD that comes with that called Immortality Forever Young. And then Rare Earths Within Cures. This really goes into these nutritional deficiencies, particularly minerals. And, of course, Dead Athletes Don't Lie. There's a lot of stuff on the things that go wrong with athletes, including the sudden cardiomyopathy, heart attack, sudden death, and so forth. And, I mean, we could talk about all kinds of arthritis and bone spurs and kidney stones, okay? And these are all caused by, and then the muscle stuff. We're talking about fibromyalgia, sarcoidosis, lupus. You get on a gluten-free diet so you can absorb these nutrients. Even lupus will go away in weeks sometimes, certainly within 4 to 6 months. Lupus goes away. Your body has the ability to heal itself. It's not an autoimmune disease, okay? Lupus is not an autoimmune disease. It's a simple nutritional deficiency. And usually they'll have rosacea on their face, which is goes along with the lupus diagnosis. And that shows you're deficient in one specific nutrient. That tells you right away that you have a gluten problem, not absorbing that nutrient. You've got to get rid of the gluten so you can maximize absorption of these nutrients. In lupus, the first thing that will go away will be that rosacea on the face, and then you heal all the muscles and ligaments and tendons. It's amazing.
The Youngevity UK and Europe show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel, and for more info on the products mentioned in this week's show, check out the links in the description.